emergency. Like, it's not when people begin to die that we begin to do what we should do. I'm happy so far at what has been done. I understand that the Lagos State government is promised to pay out some 20,000 to people. Well, how is this money gonna be? Money gonna be distributed evenly? We have a problem of data. We don't even know who gets what and how what gets distributed now. And then FG releases a price of pump fuel to what amount? How many people drive cars in Nigeria? How many people drive cars? Is it the cars that's going to translate to the feeding of people when they stay in their house doing the 14 days isolation thing? Is it the reduced fuel price that's going to translate to feeding of the multitude of people on the road? These are the questions we need to begin to ask. What are they doing? What have they put in place? Have you begun to give people even soap and provide enough water for people to be able to wash their hands? Do not take it for granted, I beg you. My fear is, if quarter of what is happening in Italy happens in Nigeria, do you know what that will translate to? 800 deaths per day. Translate that to the population that we have in Lagos State alone. In Nigeria as a whole, do you know what that would translate to? You don't want to begin to do the math. What you want to begin to do is to begin to spread the news of how serious the situation is. Begin to speak to that keke napep driver, that pure water seller, that kiosk owner in your street, that woman who owns the sewing machine shop on your street. Begin to speak to the teachers to begin to send this message home. Let the children begin to send the message home to their families. I don't know what you can do. I'm doing my bit. That's what I can do. People are making WhatsApp messages. Whatever it is you know you can do, get on and begin to do it. Spread the news, don't spread the panic, by the way. Let people know what they should be doing to keep themselves safe. If you have any symptom of a high fever, my God, fever is one symptom of malaria in Nigeria. Cold, sore throat, shortness of breath, people will begin to call it asthma and begin to treat what they do not know. We already have information that people are already treating this COVID as malaria without even knowing what's happening to them. Please, if you have any symptom, go to the hospital. How many health practitioners in Nigeria are willing to stay over and sacrifice taking care of patients? Do they even have the appropriate protective equipment? Do they even have the capacity to isolate patients? I'm sure most professionals will just do their best, and some of them will just quit the job because they are not even well paid. So you do not want to get this pandemic going on to the extent that people are not able to protect themselves, or that people are already at the risk of becoming more infected. What we want to do is to begin to reduce the risk of the virus even spreading at all. Even if we already have these cases, begin to practice social distancing. Keep your butts at home. I don't care what it is. I don't know how you want to walk out from home. If you drive to work, fine. When you are to work, keep your distance. When you're going to work, going to back home, keep your distance. If you are in the supermarket, keep your distance. Keep your distance. Now, people are out there buying face masks and all of that. Face mask has been found not to really do a lot to protect you from this virus. What you need to watch is spreading the droplets from your sneeze and from your catarrh and from your cold. Sneeze into your elbow so it's not into your hand where you're touching things. Wash your hands as often. Like, if you don't have sanitizers, the best way to even wash your hands is with soap and water. And while you're at washing your hands, ensure you're also moisturizing your hands, because you don't want your hands to be dry. Even as a nurse, excessively washing my hands, I have a lot of dry skin and it's not interesting, trust me. You want to wash your hands appropriately. Use your sanitizers appropriately. There are lots of resources out there about hand washing. Hand wash properly. Wet your hands. Ensure you're not wearing rings, washes, and all of that. Wet your hands with water and wash your hands for at least 30 seconds. That's when you know you've appropriately washed your hands. Wash your hands for at least 30 seconds. Wet your hands. Put the soap under your hands. I know we don't have taps that flow with water easily, but you can improvise. Scrub your hands. Back of your palm like that, interlaced. Your thumb, Okay, your fingers area, you scrub and scrub it out. You scrub it out. Okay, and then your wrist. Okay, and then you interlace your hands when you wash, like that. That's when you know you've appropriately washed your hands, and then you rinse out under the tap. That's when you know you've appropriately washed your hands, and dry with a towel. The same thing with your sanitizer. You apply your sanitizer, rub, using the same steps, fingers back of the palm, fingers interlaced, fingers interlocked. Okay, the thumb, your wrist, your fingers, and finally that. Listen, wash with soap and water. If you do not have sanitizers, wash with soap and water. It's going to do. The most important thing is that you are doing what you're expected to do in washing your hands and sanitizing your hands. Have a little sanitizer pack in your bag, because when you go out, you don't know what you pick up, you don't know what you're touching, especially in Nigeria where people do not even practice adequate hygiene. We do not have a set of stores that have except a few stores that we have in Nigeria. People actually go around into the big markets, Idumota, Tejo Show, Oshodi, name it, to buy things. Now, hygiene of the people who sell these things to you, you do not know. It's not 100%. If you can, wipe down the things that you buy in the markets with wipes. Clean them down before you take them to your house. When you get to your home, clean them down. Disinfect your houses with Dettol. Disinfect your houses if you can with jig, 1 in 7 or 1 in 10 parts of jig. Put 1 part of jig into 10 parts of water and disinfect and wipe down your surfaces and your house, your door handles, name it, your tables, where your children wash, where your children clean. Use Dettol. Dettol is known to kill the virus. If you read the Dettol bottle, it's there, coronavirus. It deals with it. Now, the bad thing about this virus is that it's mutating. Now, what are you doing to protect yourself? You do not want to be among those who will become infected and will not be able to access adequate health care to care for themselves. Don't worry about being treated. Worry about getting the virus. Do what you should to prevent yourself from getting the virus. Spread the message out of what this virus can do and how bad it can be. If you hear anybody saying the wrong thing about this virus, or obviously showing ignorance of what really this virus is, educate them. It is your duty to educate them. Let them know that this virus is serious. It's no respecter of status. It's no respecter of persons. It does not care. It's going to come down on you and it's going to make you less of yourself. You cannot breathe. Anything that affects the ability to breathe is liable to take away your life. Comorbidities already abound in Nigeria and Africa. You do not want to begin to have a problem from your respiratory tract. So get yourself off the road. Has the government attended to partying in Africa, in Nigeria? Have they attended to social gatherings, to weddings, to naming ceremonies, to burials that's already booked to take place? What are they doing to prevent people from beginning to go to places that will predispose them to picking up this virus and spreading it out without even knowing it? What have they done? What measures have they put in place to spread the message to people to avoid gathering? In Ghana, I do understand that people cannot gather more than 50 or 25 in a place at a time. That is a proactive government. What is the government doing? We just hear that they're spending money. What monies are they spending? How have they spent this money? In getting kits, where are the kits distributed? Our hospitals do not have enough isolation wards. How are they doing this? How many centers are already built in anticipation of a need to isolate a large number of persons? My fear is that this should not grow beyond what's happening in Italy, or even get to quarter or half the severity of what it has become in Italy and in other parts of the country, or even in the UK. Please and please, if you love yourself, if you love your family, spread the word out. Don't wait for the government to do it for you. And while you are at it, spread the right information. Let the people know the right thing and what to do to protect themselves. That is your duty as a health professional listening to me. That is your duty as a nurse, as a doctor, as a laboratory scientist. That is your duty as an advocate for health and for the people. That is your duty as a nurse advocate. Do it and let the universe bless you for it. If you have symptoms of cough, fever, and even symptoms of difficulty in breathing or shortness of breath, stop treating malaria and typhoid. Go to the hospital and get treated. Go to the hospital and get treated. Please and please